Welcome to our YouTube channel Nursing PRNCFET. Please subscribe our channel and click on bell icon for more updates related to staff nurse recruitment exams. Today we are going to discuss 100 golden key points for upcoming staff nurse exams. 1. Strawberry appearance of cervix is seen in trichomonas infaction. 2. Hunter test, a postcoital test, is used to determine the number, motility and activity of sperm. 3. At least 6 glasses of water per day and roughage prevents constipation during pregnancy. 4. Ischial spine is an important determinant of pelvis to determine descent of head. 5. Highest oxygen saturation in fetal blood vessels is inductus venosus. 6. First check cord round baby's neck when head comes out during labor. 7. Complete lack of semen is termed as aspermia. 8. Lack of sperms in semen is known as azoospermia. 9. Sperm motility is most significant criteria when assessing male infertility. 10. Lateral position is given during epidural anesthesia. 11. Missed abortion is also known as silent abortion. 12. Ayres spatula is used to take cervical smears. 13. Vertebral column is backbone of human skeleton. 14. Scapula is an example of flat bone. 15. Matured bone cell is known as osteocyte. 16. Osteoblast is a bone-building cell. 17. Osteoclast is a cell that breaks down bone. 18. Chromosomal abnormalities are common cause of abortion in first trimester. 19. Cervical incompetence is most common cause of abortion in second trimester. 20. Illegal abortion is most common cause of septic abortion. 21. Hemorrhage is main priority in spontaneous abortion. 22. Ambivalence, fear and fantasies are commonly occurs in first trimester. 23. Total number of internal intercostal muscles 11 pairs. 24. Thyroid cartilage is most prominent cartilage of larynx. 25. Ligaments connects bone to bone. 26. Tendons connects muscle to bone. 27. Coronal suture is a fibrous joint between frontal and parietal bone. 28. Sagittal joint is a fibrous joint between two parietal bones. 29. Wrist joint is an example of gliding joint. 30. Mandible is only movable joint of skull. 31. Cervical vertebrae is the smallest vertebrae. 32. Clavicle bone is known as collar bone. 33. Ball and socket joint is most movable and least stable joint. 34. Total numbers of ribs are 12 pairs. 35. Stapes bone is smallest bone of human skeleton. 36. Femur is largest bone. 37. Coccyx is made up with 4 bones. 38. Total lungs capacity is 6,000 milliliters. 39. Tidal volume is 500 milliliters. 40. Respiratory center is medulla oblongata. 41. Hypothalamus is responsible for secretion of hormones that regulates temperature, thirst, hunger, sleep, mood, etc. 42. CSF is secreted by choroid plexus. 43. Dura mater is outermost layer of meninges. 44. Arachnoid matter is middle layer of meninges. 45. Pia mater is innermost layer of meninges. 46. Occipital lobe of brain is visual portion. 47. Temporal lobe of brain is responsible for hearing. 48. Cerebrum is largest part of brain. 49. Masseter muscle is strongest muscle. 50. Stapes muscle is shortest muscle. In ear. 51. Sartorius muscle is largest muscle. 52. Peritoneum is largest serous membrane of human body. 53. Soleus is one of main muscle of the calf of leg. 54. Nullipara, PID, vaginal bleeding, cervical cancer and previous ectopic pregnancy are contraindications of IUD. 55. Hormonal IUD comes under third generation. 56. Opportunistic infections occurs when there is a defect in defense in host. 57. MTP Act was started in 1971. 58. Schick test is used in diphtheria. 59. Droplets infection is a direct transmission mode. 60. Droplet nuclei is dried reside of droplets and indirect mode of transmission of disease. 61. First case of any communicable disease in a population is known as primary case. 62. First diagnosed case is known as index case. 63. All case of a communicable disease from primary case is known as secondary case. 64. Length of duodenum, 25 centimeters. Length of esophagus, 25 centimeters. Length of ureter, 25 centimeters. 67. Length of anal canal, 4 centimeters. Length of female urethra, 4 centimeters. Length of inguinal canal, 4 centimeters. Length of thymus, 4 centimeters. Length of optic nerve, 4 centimeters. 72. Length of vas deferens, 45 centimeters. Length of spinal cord, 45 centimeters. Length of femur, 45 centimeters. 75. Tab vaccine given against typhoid. 76. Typhoid is also known as enteric fever. 77. Shift and drift are characteristic of influenza virus. 78. K-bind is used to treat hypokalemia. 79. Emollient enema is given to check/stop diarrhea. 80. Carminative enema is given to pass flatus. 81. Tongue is most flexible muscle of body. 82. Buccinator muscle is chewing muscle. 83. Weight of brain, 1250 to 1400 grams. 84. Weight of pituitary gland, 0.5 to 0.6 grams. 85. Weight of adrenal gland, 5 to 6 grams. 86. Weight of normal uterus, 50 to 60 grams. 87. Goniometer is used to measure joint angles. 88. Tympanic sound is a loud drum-like sound. For example, abdominal sound. 89. Maximum heat loss occurs by radiation, 60%. 90. Specific dynamics action of protein is 30%, maximum. 91. Nasal catheter should be placed in another nostril at least every 8 hours. 92. Autoclave is most commonly used and most effective method of sterilization. 93. Plain surgical cut is absorbed within 5 to 8 days. 94. Just before and after of blood transfusion, normal saline should be administered to prevent hemolysis in tubing. 95. Rectal method is most reliable method of taking temperature. 96. Most common method of temperature assessment is oral method. 97. Most common method of oxygen administration is nasal catheter. 98. Splint are used for treatment of fracture, sprains, strains or dislocation. 99. Vaginal irrigation should not be done during menstruation, pregnancy and puerperium because it may cause infection. 100. KMNO4 is used as mouthwash. Thanks for watching. If you not subscribe our channel at yet, then please subscribe now and give me your feedback in comment box.